Hello. My name is Melanie Wall, and I'm a professor of biostatistics in both Mailman School of Public Health and also the Department of Psychiatry in the Vagelos College of Physicians and Surgeons. I'm from 168th Street campus. You know, it's the place where people go when they get really sick. They need great care. The Columbia University Irving Medical Center. The terminated grants so far are mostly on our campus. I have two goals in my short time here. I want to educate you all a little bit about the medical center and how NIH grants work, and then I want to tell you about how this makes me feel. Yes, the medical center has a world-class med school where future doctors are taught and trained, and it has a world-class patient care through Columbia's doctors and the New York Presbyterian Hospital. These are all very well known. But also at the medical center, and just as world-class, are hundreds of health science researchers, MDs, PhDs, faculty, full-time clinicians, lab technicians, support staff, mostly funded by federal NIH dollars, who together are transforming medicine through innovative basic research, for example, to understand psychotic disorders from animal models to patients, to test new therapies for cancer and Alzheimer's, to try out new healthcare home care systems for stroke outcomes, overcoming healthcare barriers caused by poverty and mistrust, to advance integrated medical and mental health care with health analytics, to explore the impacts of environmental pollution on health, to understand intimate partner violence and the role of stress on hazardous drinking, just to name a few. All of those I just named, as of today, have been terminated. I've been collaborating with medical, mental, and public health scientists for over 25 years. As a biostatistician, I've had the honor to work with so many brilliant health science researchers, from the most junior to the most senior. Today, I'm a collaborator on 8 different NIH grants that were terminated by the Trump administration. The majority of our work on the medical campus is paid for by the National Institute of Health, from research grants that my colleagues and I were awarded following rigorous reviews in competitions with researchers from all across the country. Those grants pay our salaries, including faculty salaries, often even we who are tenured. Those grants and the salaries of most health science researchers on the medical campuses are paid for by those grants, and it's we who competed for them and won them and came out on top of national reviews. Besides the health research scientists, I also want to be sure to give a shout out to the expertise of all the support staff it requires for each grant proposal, to prepare and audit the budgets, to verify the paperwork, to set up accounts, to monitor training, to make sure that there's safety and the ethical standards for the participants in our studies are applied. Stopping these 150 plus studies mid-study is a huge waste of resources. We keep hearing the number $400 million terminated, and whether this is or is not a big number for an elite institution like Columbia. But I want to emphasize, the health research being cut is not research for the elite. It is not about elite priorities. It is research that affects all of us and our future. Over 30 training grants and early career awards were terminated. That's the training for the next generation of health scientists in the U.S., and it's going to be lost. Numerous grants labeled as DEI have been terminated as if studies looking at the impact of DEI are poison. DEI is fundamental to understanding the drivers of health and improving health for all. In the time I have left, I want to tell you how I feel. I'm angry. Trump's administration has terminated and taken hostage our grants, igniting frictions around issues of free speech and discrimination. And in my estimation, this attack is an exquisitely effective tool for trying to take down higher education as part of a larger conservative agenda hell-bent on destroying universities as we know them. However, I'm hopeful by the fact that within less than a week of the funding cuts being announced, we had amassed over 110 medical center colleagues from VPNS, Mailman, and nursing willing to openly sign their name endorsing the AAUP's letter asking the administrators to fight back against the assault on Columbia and on higher education and science. It is not an easy thing for people whose jobs are threatened or already lost their jobs to say that they openly want the university to fight back rather than try to get the money. But to my joy's surprise, many of my colleagues did. I would like to end by sharing the words of a medical center colleague who asked me to. She's already lost her position. She was the diversity director of the genetic counseling graduate program that was eliminated. She says, "We must not cage to fragility and fear and realize how interconnected we are. First, they came for the pro-Palestinians. Then they came for all the marginalized DEI people. Then they came for the scientists. And now for Mesas. Who will they come for next? Let us all see clearly that their goal is oppressing the voices of anyone who threatens their powers. We must stand up for diversity, we must stand up for self-governance, and we must stand up for science." Thank you.